Hi, this is Alexis Johnson, and the article that I read was from 2014 by Richard P. Dutton, and it's called Using Big Data for Big Research, MPOG, NACOR, and Other Anesthesia Registries. Within the last few years, there's been a lot of progress in the field of anesthesia that will have great impact on the future of anesthesia practice and for our patients. This progress is in the potential for big data, which is driven by technology that has been implemented in clinics, offices, and hospitals in the form of electronic health records and billing systems. These systems are used to create databases that can be used to link clinical decision making in the operating room and patient outcomes so that we can continue to learn and grow with every patient encounter. There are several big data databases that can be used in anesthesia, and the National Inpatient Sample, or NIS, has information about hospital inpatients, which includes surgery and anesthesia. NIS can be used to look at outcomes, especially in mortality and length of stay, and specific characteristics such as age, sex, and comorbidities. The Centers for Medicare and Medicaid, or CMS, databases are derived from clinical encounters that are claims for patient payment. It is heavily skewed toward the elderly patients due to the requirements of CMS, but it does include both inpatient and outpatient surgical procedures and anesthetics. Multi-Center Perioperative Outcomes Group, or MPOG, is an anesthesia-specific big data database developed specifically for anesthesia research. It has a standard format for collecting clinical information from anesthesia information management systems, or AIMS, and is working to transmit it to MPOG registry. Hopefully soon, every hospital with AIMS will be able to contribute data on the anesthesia procedures, medications, fluids, monitors, and vital signs for every patient. National Anesthesia Clinical Outcomes Registry, or NACOR, includes data from billing system and quality capture software. It was developed by an Anesthesia Quality Institute, or AQI, and was founded by the American Society of Anesthesiologists, ASA, to improve the quality of anesthesia practice. NACOR is nationwide, making it a good choice for a background for studies. Registries take advantage of the improving EHR systems and are moving toward direct import of the records, which will generate data that is much more reliable and consistent than self-reporting. Certain types of data, such as vital signs and medication doses, can be transferred easily, but data such as outcomes and complications lack standardization of definitions that is difficult to transfer automatically. The goal is to move from self-reported outcomes to measures that can passively be calculated from medical records such as vital signs. National healthcare reform is the driving force toward shared accountability measures. Rather than reporting on specific processes of the individual level, shared accountability measures will look at outcomes such as mortality, major morbidity, and hospital length of stay at the level of the entire perioperative team. Healthcare providers and hospitals will work together to define the measures and collect the necessary data, and eventual linkage of systems will depend on accurate patient identification and common definitions and risk factors. The biggest challenge for anesthesia data registries is the analysis and reporting. Clinicians are very busy on a daily basis with administration, education, teaching, and patient care. In order to turn data that is collected into useful information, registries need to find ways to analyze and report what they collect. One way to accomplish this is through the publication of collected data. Journal articles help to maintain level of equality and to reach a large audience. It can be used for future reference. The availability of big data in specialty areas from the national level is creating a new era of clinical practice that encourages evidence-based practice. So anesthesia in general, and CRNAs in specific, has a history of consistently improving patient safety. The evolution of big data registries in anesthesia are leading care into a new and better patient-centered future. Big data will improve clinical decision-making about drugs, monitoring, and anesthesia techniques at a national level by improving data collection and making this data available to clinicians and researchers. Thank you.